Good morning and welcome to our 45th Coffee with the Commissioner event. We're glad everyone got up early this morning. We've got quite a morning conversation for y'all today, and again, glad everyone is here and that everyone's up bright and early. I want to introduce my special guests that have joined us this morning. As always, we have our Escambia County Administrator Janice Gilley is here this morning. Glad that she's here. We have Chandra Smiley. She runs Community Health Northwest here in Pensacola, Escambia County. Good morning, Chandra. We have Gina Mulashan, and she runs Gulf Coast Diplomacy, and we're going to hear all about what she does and her programs. And then we have a very special guest from the U.S. Department of State. We've got Ms. Anne Grimes, and she is the Office Director of International Visitors. And so I really am looking forward to what each of these ladies has to say. And what we're talking about really, and what we've continued to talk about in these coffees is the ongoing COVID-19 and just all the impacts that this worldwide pandemic is having. And we started out speaking with the healthcare administrators of our local hospitals, and then we branched out to, economists, and we've spoken to small business owners. And now the conversation is going to go to these foreign exchange programs that I'm sure have been greatly impacted by travel restrictions, hotspots around the world. So I appreciate everyone being here this morning, and I appreciate the folks that are joining us online. And I really have to say thank you to Gina. She posted a video and my blog just exploded worldwide. People coming to the blog, leaving questions for Ms. Grimes. So I can't wait to get to all that. But what we typically do, this is our 45th event, and what we typically used to do is go out into the public's arena. We would go to McDonald's or Hardee's or Denny's, and I would invite constituents, and we would sit down and talk about the issues, potholes, roads, infrastructure, public safety, all the different things that we do as commissioners. And but unfortunately, now we can't go out and do that in person. It's tough if you get a big group, people wearing masks. It's just not working real well. So eventually, I look forward to doing that again. But meanwhile, this has given me and really everyone an opportunity to learn about a lot of different aspects of what's going on in our community. So without further ado, I want to welcome Janice Gilley this morning, and I look forward to a great update from Janice from the county. Good morning, Janice. Oh, wait, I guess I have to unmute you. Hang on, let me unmute. There we go. Good morning, Janice. Let's try that again.
Thank you. I appreciate it. As we are speaking about COVID, one of the things that we like to do is we like to encourage folks to continue to do their testing if they have any concerns or issues. And as you know, Chandra and her team have been an amazing group of partners along with our hospitals. And so one of the things that I'd mention is that, Community Health Northwest is still doing walk-up testing, and I'll let Chandra go into that whenever she gives her comments. But we also have Baptist Healthcare that can help you with, as their screening center. You call the 434-4080 number, and that is available 24 hours a day online. Also, there's a screening assessment with them there. The UWF testing is available 9 to 5. We have FDOH in Escambia. You just have to have your driver's license. And then we've also mentioned that One Blood is available to do the antibody testing. So you do need appointments to donate. The other thing I would mention is, as you know, the governor has talked about the spikes in the state of Florida, and I'm sure Chandra can give some more detail into this, but what he has said this yesterday, I believe, was that some of their issues are specifically related to high-risk populations, whether it be the migrant farmers or some of the jails and prisons and long-term care facilities, or where they're getting a lot more testing having been accomplished. And then the other thing is that people being in close proximity to each other tends to be a very high predictor of whether or not you're going to transfer that positive case from person to person. And then he did also say that we are having younger people that are testing positive, but they are not necessarily part of that high-risk population for hospitalization or ones that are stressing the medical system. So I thought that was good news, but Chandra may be able to provide some more context to that. Just from a county standpoint, I wanted to mention that we did have our committee of the whole yesterday, in which we did discuss the children's services tax for the ballot for the citizens to consider in the fall. We have the Escambia County Youth Employment Program going on, which we have over 100 young people that have come and joined the county as employees throughout this summer. And the good thing about that is introducing students and young people to government in such a way that may give them an opportunity for a career in the future. As we know, with baby boomers and others, aging out of the workforce, we have a gap in terms of the
Yes.
people that we need for employment. The county, we also announced our workforce housing initiative in right off of G Street this week, which is a great opportunity for workforce housing for teachers, healthcare, law enforcement, construction, to give them an affordable opportunity. And then I would just also mention, people love to hear about the turtle nest. I mentioned last week that unfortunately we did lose 2 nests with the Cristobal storm. But we did have a loggerhead show up on Perdido Key, and so we're very thankful that they are still coming to our shores and putting those babies there for us to hopefully have hatched later this summer.
Janice, let me ask you something, because I remember we talked about that a little last week, and I read about that in the paper, and that is devastating because I think one of the turtles was a Kemp's Ridley, and I know they're very endangered. Did we keep that nest, or did that nest get wiped out?
We did keep that nest. It did have some waves come over it, some water come over it, but it did not destroy the nest. So that was a good news from last week. And that one is the one that we have exploded in terms of just like you said, social media and people
Yes.
being very, very interested. And it is in a very high profile location right there behind Crabs.
Oh,
So,
boy.
and yeah, and we are hoping to consider maybe like I think Nan Harper has mentioned baby showers for the turtles, but we've mentioned maybe having a contest to see people guess when the first baby's going to come out, and maybe we have a gift basket or something for the person that actually chooses the date, time, and second.
That's pretty cool. I'll get behind that. Hey, I wanted to ask, when we lost the 2 loggerhead nests, and I know you wear many hats, Janice, and so today I expect you to wear your wildlife biologist hat. So what does it mean lost it? Why couldn't we save it?
Well, what happens is it means that the waves, eroded it in such a way, and that there was damage to the nest itself. And so it's not able to be recovered. There are some communities where they do actually try and go in and, I don't want to say excavate the nest, but they do kind of try and do that to put them into kind of an incubator. We just have not taken that tact on our beach that I'm aware of. Maybe Gulf Islands has, I'm not sure, but we have not necessarily done that in our region. The other thing that's kind of sad about, unfortunately, with the turtles, it's almost only 1 in 1,000 actually make it to full maturity.
Yeah.
And so that's why they're so important to try and protect, so that we do continue to have that beautiful. If you've ever been in the Gulf and seen them floating, it really is a beautiful,
It's wonderful.
sight.
It's awesome. And what's terrible is when you see them caught up with nets and hooks and stuff. There's videos online you could go watch, and good Samaritans pull them into the boat and take the hooks out of them and stuff. It's really cool. That's what I would do if I saw one.
Yeah, and so the other day, our lifeguards are trained to help, and apparently in the past couple of weeks, someone did actually hook one at the pier. And so what they do is they tell you don't unhook them. So they actually told them to throw the the pole into the Gulf.
Oh,
And
I don't
so
know if I'll go that far. I'll cut the line. I don't know if I can throw my pole away.
Yeah, no, yeah. Well, I think they did recover the pole later, but that was how they were able to help recover the turtle too.
Interesting. Well, before we kick it over to Chandra, I want to follow up on that, because that was an important discussion that we had yesterday about the Children's Services Council, and we've been lobbied as commissioners to bring this before the board for a vote to put it on the ballot. But what I tried to explain yesterday, what I tried to say yesterday is my support for this is to put it on the ballot. I believe, it obviously is it's going to entail a tax increase on the citizens, a property tax increase. And I'm a staunch fiscal conservative. I've never, ever in 13 years raised year-over-year millage tax rates. I have not. I've actually voted against them even during the recession. So, but I believe it's a worthwhile idea. And I know that we have tremendous need in our community among students and young children, just for a number of different reasons: generational poverty, social dysfunction, no one working in the house, parents in jail, things of this nature. So with all that said, I think this could be helpful. But what I tried to say yesterday was yesterday's discussion was just an introduction to the program. And then what they want is for us to put this on the ballot. And that's only the board of county commissioners can do that. So I'm certainly willing to make the motion to put it on the ballot. And I think anytime you're going to try and extract more money out of the taxpayers' pockets, it should be on the ballot, and they should be the ones to decide. And we have a very generous community here in Escambia County. We've had the penny sales tax, which helps the county with infrastructure. When I was on the school board, we had the half penny tax, which allowed us to build multiple schools. So this is a generous community, but I want to make that crystal clear. It's not the board of county commissioners. It's not Jeff Bergosh property taxes. I already had a few phone calls on that. Crystal clear. It's a two-step situation, a two-step proposition. Step one, it goes on the ballot, and then everyone gets to decide. You, me, we go in the ballot box. If we think it's good, we vote yes. If not, we vote no. But it's not us raising your taxes. Just want to make that very clear. And sorry about that. I'll get off the soapbox now, and we'll kick it down to Chandra Smiley. Chandra Smiley, you're the Executive Director of Community Health Northwest. Tell us all what you do and what your organization is all about for those that may not know.
Okay. Well, first of all, thank you for inviting me to be a part of this morning's discussion. Community Health Northwest Florida is a federally qualified healthcare center, and our mission is to provide comprehensive healthcare services to all who walk through our doors. Mostly, we take care of those who have limited access to health insurance or no insurance. We have 18 sites throughout Escambia and Santa Rosa County. Last year, we took care of close to 55,000 individuals.
Wow.
Our service spectrum is everything from primary care services, pediatric care services. We have dental clinics. We offer behavioral health and wellness services. We have 2 pharmacies, as well as we contract with pharmacies to assist people in obtaining needed medications. And we offer optometry services. Soon to go online, hopefully. Certainly the COVID and everything that we've been going through this year, we had to hit the pause button, but we're well on our way to adding chiropractic services to our service spectrum. So we've been around in the community since 1992. So many people are unaware that we were birthed out of a partnership between the county and the hospital. So our roots are deep in partnership. We are kind of the original model of what collective impact can look like and how beneficial it can be. We became an FQHC in 2008, and that's when our service spectrum expanded in our capacity. So that's the quick, 2-minute spill on who we are.
You have multiple locations too, don't you?
Yes, we like I said, we have 18 locations. We have 2 locations in as far north as Century. We have a pediatric clinic in Century that offers pediatric dental services. It's a co-located service location, as well as an adult practice that also recently we added dental services to. We're in Cantonment. Certainly our main site is on Jackson Street. We refurbished the old Alianestra Elementary School a couple of years ago and converted that into a primary care site, but it also houses our administrative offices. We also have walk-in clinics. We have an adult it primarily serves adult patients over on Jordan Street that's open 7 days a week. And then about 1.5 years ago, we opened a pediatric walk-in clinic on the campus of Sacred Heart, and it's our pediatric convenient care. So it's 7 days a week as well, trying to make sure that we are reaching out and offering more appropriate places of utilization for acute care needs versus folks going to the emergency rooms.
And that's where the county saves money on our Medicare. A lot of people don't realize that local counties get crushed with federal requirements, and then we have to come out of pocket. And it's grown every single year. So organizations like yours and others, the free and charitable health clinics, they save us money, and they're really a good investment. And I know you and I have met in my office a couple of times, and we've talked about budgets, and it's always difficult, but there is a return on the investment for the free and charitable and the clinics like yours. So we appreciate everything you do in the community. One of the things, getting it back to COVID-19, is your organization stepped up, and you were one of the first to really start the testing. And now we have a very robust testing situation in Escambia County. A lot of other areas of Florida are envious because we've had so much availability. We're very close to testing about 10% of our population. We're getting up there in the high 20,000s of people tested. So tell us a little bit about how that started and the number of people you're seeing per day in testing for COVID-19.
So it started, Sacred Heart opened up the first drive-up testing. And then very shortly after, we partnered with Sacred in sharing staff in the call center. This was back when screening was the criteria for testing. And then we moved to realizing that the populations that we take care of have limited access to transportation. And we knew that just by their communities, they were more vulnerable, and felt that we really needed to take our testing and mobilize it, take it to the communities where most of our patients reside. And that's where we partnered with the county. Commissioner May opened up Brownsville. So we were at Brownsville for many weeks offering drive-up testing. And then we went, like I said, mobile. So we went into HUD housing communities. We've traveled all around the county. We've been in Cantonment. We've gone up to Century. And our schedule right now is we're out 2 days a week, and people are calling and requesting. So for instance, tomorrow we're going to be over in Warrington at New Dominion Church.
Okay.
Wherever we go, it's open for the community. So there is no pre-screening requirement. We do ask for photo ID if you have insurance, but if you don't, that's not a barrier. We're going to take care of the test for you. And then on Friday, we're scheduled to be at Dixon School of Arts and Sciences.
Right on.
And I'm sorry, I said New Dominion. Tomorrow is Alabaster Gardens. I'm sorry, it's Alabaster Gardens off of Massachusetts. Next Wednesday is New Dominion in Warrington. And we're in communications with Moorings Apartments for next Friday. So every week, we're getting calls, and certainly I put that out there to the community. If you have a church or you have a community center or a space that you feel like could accommodate walk-up testing and would like for us to be there, please give us a call, and we certainly will make every accommodation we can to meet those requests.
Let me ask you a question about the testing specifically, because folks like me, I'm kind of curious about it. So I come up to your site, I have Blue Cross. I can show you my Blue Cross card and my photo ID, and I'm going to be able to get a test if I want to, even if I'm asymptomatic, even if I say I feel fine, but I just want to know.
Yes, you have to, there's no screening requirement. What we are finding in our testing is that there are a lot of people who are asymptomatic that are in fact positive. And so that's pretty critical. That's critical in understanding. One, that's why the CDC has the guidelines that they do in terms of wearing face mask and making sure that you keep you wash your hands, keep your hands away from your face, acknowledge social distancing, because there are many people who they feel fine. They have no symptoms and have no knowledge that they are contagious.
Yeah, and see, that to me is the puzzling question. Over the last several months, we've had all the hospitals. We've had Dr. DeVecchi, who's an infectious disease specialist, and I've asked them all the same question. If you're one of these asymptomatic carriers, how do you know how long you've had it? How do you know how long you're going to have it? How do you know when you're contagious or if you are? And what's the difference between that and someone who had it but then has recovered? Is there a difference? And it's real puzzling to me. I'm not a scientist or a doctor, and I really haven't been able to get a straight answer. So that's pretty scary what I'm hearing from you. So you've had folks in your experience come up and feel fine, but boom, they pop positive. How quickly do the tests come back? That's the other question I'm very curious about.
So it's varied throughout this process. When we started, we were looking at a 5 to 7 day turnaround.
Right.
It's gotten, certainly our reference lab has picked that pace up, and we're looking at 48 hours, and in some cases 72, but mostly it's been about 48 hours. The test that we provide is the nasopharyngeal, so it's a swab.
Yeah. Is it, do people sneeze and cough and blow up when that? If someone tried to do that to me, I'd be a sneeze machine. It'd be a disaster.
We have had to do the oral swabs just when supplies were low, but the nasopharyngeal is the one that we would prefer, just because of the success in collecting a viable specimen to be tested. So in our collection success has been extremely high. I could probably count on one hand the number of specimens that have been sent back because it wasn't enough collected to proceed with the testing. But again, it's about a 48-hour turnaround. We are asking people to quarantine until we give them a call to let them know their test results. Certainly hand them information as they leave, and we were able to, with the health department, get some of those cloth masks. And so as we're testing, we're going to be handing out cloth masks in packets of 5 for people who have families, so that they can bring back to their family. So
That's great. Well, a final question for you on this, because I'm just very curious about this. So if I walk in, I'm feeling fine, no symptoms, still working my job. I got a small office with folks working all around me all the time. And I come in and, I'm just speaking hypothetically, but say I'm a guy who's values his privacy and I really just want to keep it private. Do I have to sign a waiver saying that you get to disclose my name, who I am, where I live? People are freaked out about that. So I'm just curious, what happens if Jeff Burgash goes in, tests, and oh no, he's positive, but do I suddenly am I suddenly unable to go to work? What happens after?
Well, there's HIPAA laws that protect your health information and your privacy, and certainly calling an employer or notifying is not something that we would be able to do or should do. We would certainly educate you as a patient on what you should do, and would strongly encourage you to quarantine and notify your family and anyone that you've been in contact with. We certainly have to provide that data and information to the Department of Health, and that's why you get those number of cases each day, and it's broken down. Are they Florida residents? Are they non-Florida residents? I was reading an article yesterday in the P&J, and I was surprised to see that 21% of those tested are non-Florida residents. It makes sense, but to see it, so we have a lot of folks traveling into the area.
Well, and I know that I said that was the final thing, but I'm going to dedicate the rest of the show to Ms. Grimes and Ms. Mulashan. But I have a final question on the COVID though. We see the data, and it almost appears as if they want to show the straight line going up with the new cases. Oh no, big number, over 1,000. But no one's talking about what recovery looks like. Like how many have recovered in Escambia County? I've got the data from this morning. We've done 26,165 tests. As I said, nearly 10%, 7.5% of the population. That's really good. We've had 1,020 positives, 72 hospitalizations, and unfortunately 38 deaths. But it's my understanding primarily those are folks in their 80s. Primarily in long-term care facilities. So what does recovery look like? And how come nobody measures that? I look at the state dashboard because, obviously not everyone's dying, and a lot of these positives happened 2 months, 3 months ago. So what happened to these people? What does recovery look like? And because I think the fear is that you have this scarlet letter syndrome right now in the paper today, in the News Journal. A restaurant's been singled out and they said, oh no, an employee at this restaurant has COVID. So, that's a death sentence to that restaurant. I hate to say it. And now we have a bus driver. It's my understanding. There's rumors flying around. Janice might be able to weigh in on this, but we have a bus driver at the county that apparently is tested positive. I don't know how that got out. I don't know who leaked it. Of course, we don't know the person's name, but so what does recovery look like? That's the question, Chandra. And why do they not track that on these dashboards, in your opinion?
Well, so for us, any patient that's been tested positive, we have a physician doing a virtual or a call with them regularly, following them. One, we want to make sure, how is their recovery going? We've had just a few that we've had to refer on to the hospital because their condition was deteriorating to a point where they needed to go for medical care. Mm-hmm. For those that after, I think 7 to 14 days of no more symptoms, we have retested those positives until they test negative, and then give them the clearance that they need to go back to work. Mm-hmm. What recovery looks like from a health standpoint, it's different for everybody. There are some people who just remain asymptomatic the entire time. There are some people who, develop the symptoms and become very sick and then recover from that. It's treating the symptoms. There is no vaccine. There is no magic, take a Z-Pak and you'll be done. So we are following our positives. We have had some that, even though they're asymptomatic, we've tested them multiple times and they continue to remain positive. So it's hard to say, here's the path to recovery and here's what it looks like, because there is still so much unknown.
Interesting.
And I think part of studying it would be recovery. And I think the antibody test is one of those data points and lab tests that we could do to to look at how long does the antibody stay built up in your system and how does that help, or does it? You know, we haven't elected to offer the antibody test just because I think that there's some more tests or some more studies that need to be done. And I do know that there are studies being done to look at the, you know, validity of the data. I don't want to put anything out there and there be a high rate of false negatives or positives. But I do think we, and I mean, as a country and as a state, are kind of moving into a direction to study recovery.
Yeah. Well, I look forward to that because I mean, the question I would have is this something that can come back on you? Is it like some simplex viruses that you never really get rid of it? It comes back. I mean, do we know that? And if you're an asymptomatic carrier, how long can you be an asymptomatic carrier? Can you be walking around with this thing for months and months? And if you are you contagious? See, I just have too many questions and I know that there's not answers for all of them. So I just think the way we've handled it and everything, it will probably be the subject of many doctoral dissertations in the future. But Chandra, I appreciate all your input and being here this morning. And hopefully you can hang with us till the end and in case we talk about any other stuff related to COVID. But next, without further ado, and I appreciate your patience, Ms. Grimes and Ms. Mulashan, we've got Gina Mulashan from Gulf Coast Diplomacy. Welcome this morning. Thank you for being here. I appreciate you coming on the show, and I'd like you to introduce yourself and tell us about your organization, and so that people know what you do here in the community.
So my name is Gina Mulashan, and I'm the founder and executive director of Gulf Coast Diplomacy. We recently changed our name from Gulf Coast Citizen Diplomacy Council. It was a great name to get people understanding what we do, and we were founded in 2008. But we felt it was time to maybe shorten it a little bit. So our job with the council is to work with professionals in Washington, D.C. who are part of the U.S. Department of State's International Visitor Leadership Program Network. And I'll let you describe what IVLP is and why it's so special. But our job is to partner and collaborate with people in Washington, D.C. to implement the programs on the ground here in Northwest Florida. What that means is we are 2.5 people in the office, and we have about 100, and we have a lot of members, and we have a slew of volunteers that make it possible. So last year, for example, 95% of our visitors are professionals, and they're from the U.S. Department of State. And last year we hosted, between the professionals from the Department of State, from professionals sent to us by the U.S. Congress, and a youth program sent to us by the U.S. Department of State, we hosted 192 visitors during the calendar year. And what that means on the ground is we reach out to see, so each project has a theme, and these themes support U.S. foreign policy. And so we look to see who in our community could address those particular themes or particular parts of that theme. And then we act as a connector or a bridge between Northwest Florida and the world.
Let me ask you a quick question and interject something. I know as a county commissioner, we've had groups of foreign dignitaries come and watch our meetings. Are you responsible for that?
Yes.
Oh, okay. Okay. Right on. And my children went to Brown Barge Middle School, which is a public school, but it's a magnet school. They use the streams concept. It's very, very, I mean, lots of art, lots of, I mean, just hands-on stuff. Great middle school in Escambia County. I'm a big cheerleader for that school. It's one of the highest performing schools, but there was a lot of international, there was a Japan club. There was a lot of international things. As a matter of fact, we had foreign exchange students from Japan come and stay at my house. It was really amazing. It was very fun. Are you plugged in with the school district? Do you work with, like, say, a Brown Barge Middle School to bring foreign students into the community?
So we're not bringing in foreign students. So our focus is short-term exchanges. So the students that we bring in are for 12 to 13 days, and they're with leadership programs. But we do take our professionals into, actually we went to Brown Barge twice last year.
Oh, did you?
Possibly at the beginning of this year. But I know twice last year we went into Brown Barge with our professionals to meet with administrators, to give presentations to classrooms, to see the streams. They call it streams, right?
Yes, ma'am. Yes.
See how they implement the streams at the school there. And so when we're bringing, we've taken visitors into lots of different schools in Escambia County. Yeah, it's and Santa Rosa as well.
Right on, right on. Well, let me ask you the big question, because we're, as you know, the theme of what we're talking about is this COVID-19 pandemic. And as I watched the news last night, apparently there's a big blow up, a real big flare up in Beijing. And it's interesting. I know, Ms. Grimes, you were actually stationed there in the Foreign Service. So, as I was reading that, I was thinking about this morning and getting the opportunity to speak with you. But how has the COVID-19 really impacted what you're doing here locally in Pensacola, Gina?
Oh, well, here locally, I will say we're not doing any in-person exchanges right now. So that's been
The Zoom, right? A lot of Zoom stuff.
right. And we did have visitors from China scheduled to come into Pensacola earlier in the year, but those programs were put on hold because this was pre everything shutting down. But that was put on pause, so we did not receive those visitors. But in January and February, we had 6 groups in town. 4 of those were with the International Visitor Leadership Program. One of those was, and I think you met them, they were youth from Central America, and that was
Yes. You brought them to our meeting. I remember that. Yes.
And we also had a U.S. congressional program in town in February for 8 days.
Wow. Very interesting stuff. Well, Ms. Grimes, you've sat patiently on the Zoom call. Thank you. Thank you for getting up. Are you in Washington, D.C. today? Is that where you're calling in from? You're muted. You got to unmute. Did I mute you? Let me see. How do I unmute you? Hang on. We got a little technical.
Oh, I was able to unmute myself.
Oh, okay. Good morning. So are you calling in from Washington, D.C.? Is that where you're stationed now?
I'm calling in from a suburb of Washington,
Okay.
D.C., Vienna, Virginia, from my house.
Oh, Vienna. Okay.
Because, my bureau at the Department of State is on 100% telework at the moment.
Oh, okay. So Vienna, Virginia, that's the home of Navy Federal Credit Union, and they have a gigantic presence here in Escambia County. It's a coincidence. So tell us about yourself and what you do for the State Department.
Well, thank you for inviting me to be here this morning. It's I always get up early, so this was perfect timing for me. I love it.
Thank you.
I'm pleased to be here along with Gina Melencon from Gulf Coast Diplomacy. They're one of our great partners. Before I talk about the effects of COVID, I just want to talk a little bit about the background of the program very briefly. The International Visitor Leadership Program, which we call the IVLP, is a State Department sponsored exchange program that helps strengthen U.S. engagement with countries around the world. And we cultivate lasting relationships by connecting current and emerging foreign leaders with their American counterparts through short-term visits, as Gina was saying, to the United States. And in a normal year, we bring about 5,000 exchange participants to the United States each year. And last year, as Gina said, you had about 190 visitors. About 140 of those were hosted, were IVLPs that were hosted by Gina and her team.
Wow.
And in the 3-week programs, in addition to coming to Washington, D.C., we typically send these participants to 3 to 4 other cities around the United States so they can experience the diversity of the country and meet Americans from all walks of life and learn about issues not only from the federal perspective, but state and local issues. And that's why thank you so much for meeting with some of our visitors. We really rely on folks like you to do those meetings and give them that local perspective. They also meet with NGOs, grassroots organizations, and volunteers. And one thing that everybody loves, they get invited to a local family's home for a meal. We call that home hospitality. And we couldn't do this program without the public-private partnerships we have across the United States with organizations like Gulf Coast Diplomacy and all of our other, they're called the Global Ties US is the umbrella organization. We have Global Ties members across the United States. The IVLP is the United States government's oldest exchange program. We are celebrating our 80th anniversary this year. And we are doing that. Luckily, we planned it even before COVID. We planned it as mainly a social media campaign. So there is a website that's called eca.state.gov/faces of exchange, where you can go and read about some of our visitors who have gone back to their home countries and made a real impact on their communities and their nations because of things they learned through the International Visitor Leadership Program.
Well, Anne, I was going to tell you, several of those graduates have come to my website and left questions for you. So as we move through, I was going to pull some of these. I mean, these are from all over the world. It was just such a pleasant surprise when Gina and I were talking about bringing her on the show and talking about COVID. She goes, "Well, there's some other people around that might be interested." I was like, "Well, maybe not." But man, I tell you what, you really blew this thing up, and it's fantastic. But you've got a lot of graduates of this program that are very, very appreciative, and they put comments on my blog, and everything is very, very interesting. But one of the questions was why a diplomacy program like the IVLP is good for a medium-sized town like Pensacola, in your opinion, Director Grimes?
Well, in my opinion, there are both tangible and intangible benefits.
Mm-hmm.
The tangible benefits are when we bring visitors in person, obviously they stay in your local hotels, they eat in your local restaurants, they go shopping for your local goods in your stores. So there's an economic impact in that way. Intangibly, they meet with, as Gina was saying, with students, they meet with people like you, they meet with NGOs, and a lot of people don't have the wherewithal to travel internationally. Even when that's possible, they don't have the money or they don't have the time. Right. And this may be the only opportunity some people get to meet someone from another country, learn about other countries, and learn about other parts of the world.
Do you think now that the COVID-19, I mean, obviously it's a terrible pandemic, deaths all over the place, but could there be a silver lining in that we've expanded these technologies like Zoom? I mean, I look at it from my own lens, going to the Hardee's with 8 or 10 guys talking, that was great. And I like the personal, but doing it on Zoom when I get thousands and thousands of people that can watch it, and they do every week, is this going to be a silver lining for your program as well? I mean, have you been able to tap into something that might even be better than what you're doing right now?
Yeah, we put our programs on hold in mid-March, and we had to turn around about 300 visitors who were in the US at the time and get them home very quickly. And we have paused our programs. As of right now, they're paused through September 30th. We don't think we will ever give up the in-person part. We're going to get back to that. But what this has taught us, and you're right, it is a good way to look at it is as a silver lining. This has taught us there are other ways to reach people. And we have pivoted to virtual programming. Gina took part in one of our very first virtual programs earlier in the year. She invited a state senator, I believe it was, to talk to a group who were across Europe.
Oh.
Right, Gina?
It was Representative Andrade, yes.
Oh,
Yeah.
okay. Yeah.
Okay. And so, yeah, and now as we look forward in the program to the future, as I say, we're not going to replace the in-person. We're really looking forward to the day we can bring those people in person again, because I think everybody knows that it's really those last 3 feet of diplomacy when you meet people and are able to see them face to face. That's so important. But we're now looking at what we're going to call a hybrid program of actually having some virtual elements even when people come in person.
Wow. Well, that's really nifty. As a kid, my dad was in the Navy, so I'm very fortunate in that I got to travel overseas and actually live overseas. I've traveled as an adult, but you're absolutely correct. You can read about things, you can talk to people online, but I guess we can't shake hands anymore, right? But meeting someone in person, that's really where the rubber meets the road. So that's good to hear that the program's not going to die just as a result of this pandemic. Now I'm looking at you all. Here we go. And I think my connection might be weird. Okay, now you guys are all moving in slow motion. I hope my voice isn't moving in slow motion. We could have some technical glitches going on here, but another question that came through was, and of course this is, you might have already answered, but how has the COVID-19 disrupted the IVLB program? And I think you've already said that it's on hold through September. Is that correct?
Correct. Through September 30th. We brought, as I said, we normally bring about 5,000 visitors a year. We had brought roughly 20% of our visitors at the time we shut down. So there are 80% that have not yet come that we're planning to come. We are still, I'm an optimist. I have to say I'm the eternal optimist, and I am still hoping that possibly We might be able to start bringing visitors again later in the year, October, November, December. But if not, we'll keep working on the virtual programs, and we will keep working towards the point where we can bring people again in person.
Let me ask you, how do you handle the language? You're dealing with, I was reading about some of the places you were stationed. I mean, kind of out, I mean, not the normal places that you would think of when you look at a map. I mean, it's not like Paris, France. I mean, you were in some really, how do you handle that language barrier? I know you're trilingual, or do you speak 4 languages?
Well, if you count English, I have 4 languages. And I came into I should say I'm a U.S. Foreign Service Officer. So I've been posted around the world, and I came into the Foreign Service with French. I was a French major in college. But then for some of the other languages, the State Department has a training facility where they actually teach us.
Oh,
so my other languages are Bahasa Indonesia, and my French and Bahasa Indonesia are quite good, if I do say so myself. And I have some Mandarin, but my Mandarin is just not as good. It's a hard language.
Now, let me ask you kind of an off-the-wall question. I got to do it because I always do that. And yeah, I'm a bit of a Star Trek buff, I admit it. And they've got the universal translator that when they meet, do you think the technology, I know that they've got Google Translate, they've got other little devices you can punch in, where's the bathroom, and then it spits it out in whatever language. When do you think we're going to have that technology where you and I are talking like we are and it translates what we're saying? When do you think that happens?
Oh, that's a hard question. It's not my area of expertise, but I've used Google Translate. It works a lot better for some languages than others. It's pretty good for French. It's not good for Mandarin. If you see some of what it would spit out for Mandarin, it's not that great. But we're working on it. And one of the things I should say is that the IVLP is one of the few programs that the State Department offers where English is not required. Most of the exchange programs, Fulbright, the academic exchanges, and some of the youth exchanges, they have to speak English before they come. But we have, the State Department has a team of interpreters who work with our program. So we bring people who don't speak any English at all.
Wow. In your experience, and this is for Gina and for Ann, do you find that overseas folks learn English? I mean, it seems like a lot more people learn English than Americans learning other languages. I mean, is that your experience as you deal with foreign nationals?
A lot of people do have English, a lot more than when I started out as a Foreign Service Officer 30 years ago. But there's still quite a world community out there that does not have English. And we're very proud that we're a program they can still come on, even though they don't have the language.
Mm-hmm. Interesting. Well, I want to read a question I got from one of your alumni for you. Her name is Isabel Diaz Torres, and she would like to say, my participation in Pensacola as part of an international visitor program leadership was a unique opportunity to learn at various levels the possibilities of the interactions between economic activities such as tourism with strategies for environmental protection and mitigation. Knowing firsthand the hard work you do in Pensacola, from government agencies and NGOs to little private businesses, it served as an inspiration for the search for solutions to the great challenge of sustainable development. I wish you the best results at this meeting with the hope that it will serve to continue promoting this type of inclusive program. So that's a very nice compliment, Gina, that one of your alumni, and then I don't know if I can pronounce this name, but I'm going to try. Muthukumar, and he says, I am Muthukumar from Sri Lanka. Do you all know him? Do you remember him?
Yes.
Okay. When my visit to the U.S., I enjoyed Pensacola because I got good respect. Appreciation from executives. I thank all the members of the authority, and I know they will change the present situation in a positive way. Well, that was very nice. Tell me about this guy, Gina. What was his deal? He's a pretty cool guy.
Well, we have many visitors from Sri Lanka and from all over the world. So, last year we had fewer visitors than we normally do because I spent 25% of my time developing curriculum for our local youth education program. Mm-hmm. Usually we have about 250 visitors a year, so I don't have all of their bios memorized. I do remember some of the smiling faces and interactions we have via email and Facebook, so that's always nice. And just a quick plug, tomorrow we are having what we named it the Small World Cafe. So in March, when I realized what was about to happen with everything, we quickly pivoted and began offering our Youth Diplomats program, which is our local education program for teens, focusing on international relations and cross-cultural communications. We put that online. We took our Great Decisions program, put that online, and then we created something new, the Small World Cafe. And this is one of those silver linings, Anne, because we realized when we are so busy preparing for visitors, and in 2019, for example, 284 locals met with the visitors who came into town. So you can imagine how many meetings that is to line up. We're so busy doing that, and then the visitors come and our focus is on the visitors and extending hospitality. Once they leave, they'll get an email from us around New Year's, but that's pretty much it. Well, the silver lining is we have some time to think how to connect. And so every 2 weeks, we're offering what we're calling the Small World Cafe.
Mm-hmm.
And I've reached out to different alumni who speak English and have asked, would you be interested in doing this and sharing with not just our members, but we have people from all of the United States calling in on these Zoom talks, and it's promoting our region at the same time, I have to say, because people are curious about what these visitors remember about Escambia County, Northwest Florida. Tomorrow's visitor is Marini de la Vera,
Mm-hmm.
and she's one of the 10 2019 International Women of Courage. She was awarded that by the U.S. Department of State, and she's coming to talk about her time in her work in Sri Lanka, and she works to protect at-risk children.
Wow.
Yeah, so every 2 weeks we have someone new. It's been fun.
Well, I got a letter. I got another one from our Azaria R. Perez Rodriguez. I believe she's from Nicaragua, but she wrote the entire, she wrote, I'll put this up on the camera, see if folks can see it, but she wrote the entire thing in Espanol. Now I took Spanish. Can you see that? Maybe someone can translate that.
I'll tell you though, I saw that on your blog last night and I was like, oh, wow. But then I checked my email and she sent me the version in English.
Oh, she did. Oh my gosh. Okay. So I was going to put it through Google Translate and just see what it said, but I thought that was kind of cool. And then Mr. Robert Hajek said he accompanied small groups of professionals to Pensacola as a liaison with the International Visitor Program sponsored by the State Department. And the visitors appreciated the sense of inclusiveness. They were invited to speak in panel discussions with their American counterparts. There were guests in the school settings and in the homes during an evening meal. And the schedule included downtime with a variety of cultural events. He was very, very thankful for what you all do. Arum Rashid he says he belongs to Gizlit, Baltistan. I have no idea what that is. If that's a country, I apologize, I don't know. Have you heard of that?
Yes, she came to Pensacola in May of 2015, I think.
Wow, okay. So this is, COVID-19 has really changed America, right? We know that, but I mean, how in the world, I would never know about any of this. So I guess there's some silver linings to be had from these things that happen to us. But so let me ask Director Grimes, and I appreciate you being on here. What do you think the future is? I mean, after September, when the restrictions are lifted, do you think this thing cranks up back to the way it was before? And what about the funding? How is your operations funded?
Well, we are funded by Congress, and I'm really happy to report that we are supported. It's a bipartisan support. We have supporters on both sides of the aisle. And a lot of congressmen and women realize the importance of international exchange and support us greatly. So we're hopeful that our budget will remain stable and that we will be able to crank back up to our normal levels. Again, well, we will have a new dimension with virtual being able to be put in the mix. But yeah, that's our great hope that once things get under control, we will go right back to where we were, but a new version of what we were.
And do you all track like the success stories of, like, say you bring visitors over and and they're from countries maybe impoverished or third world. I don't know if is that politically correct? I don't know. Is that still a term I can use, third world, or is that not?
Developing countries.
Okay, developing. Okay, I'm sorry. Please forgive me. I'm like a dinosaur. But okay, so folks go back to the developing countries. Are there like success stories? And if so, like what is the greatest success story that you've seen as a board?
We have a lot of success stories from famous. I should have mentioned that some of our alumni include Margaret Thatcher, Tony Blair, Jacinda Ardern.
Really?
Indira Gandhi. So about 500 of our alums went on to become heads of state or heads of government.
So Margaret Thatcher.
Margaret Thatcher.
The Iron Maiden. I'm a huge fan.
1967. She came on our program.
Wow.
1967. Wow. And she wrote a letter after the program to thank us for the program. And, you know, it was a typed letter. She was a politician at the time, but she wrote in at the bottom, "Forevermore, I shall be a friend of the United States."
That's fantastic. That's interesting. See, I who would have ever known that either? Indira Gandhi. Oh my gosh, really? So she came and wow.
Yep.
Really,
so
really.
Yeah, we have some, and then we have, I mean, what I consider sometimes even better success stories are someone like, this is a person that I nominated. The way that people get to come on the IVLP program is foreign service officers in our embassies and consulates abroad nominate them.
Okay.
One of the people that I nominated when I was in Mumbai, India, is a man named Biplap Paul, and he works in water. And he works in a state near Mumbai. It's called Gujarat. And it's a very arid state, and they have a problem with water and crops particularly. And he came to the United States and he visited Miami. He wasn't in Pensacola, but he did visit Miami, and he visited Nebraska and several other places. And he got an idea for a water irrigation system. And he went back to India and he taught it to rural women in Gujarat, India.
Really?
And they are now using this system. And then it spread across India. He taught it across India. And then he started getting inquiries from abroad, from Rwanda, from Pakistan, from Cambodia. And so he has now taught this water irrigation system in rural communities around the world.
That's amazing. That's cool. And he learned that going through this program.
Correct.
How awesome is that? Well, you know, you hear the stories about areas of Africa where they walk, you know, miles and miles with a bucket on the head to get the water. And then the technology company comes and says, no. And they dig a well, and then suddenly the well feeds, you know, provides water for the whole village. Do you guys do stuff like that? I mean, also, do you work with like nonprofits? Like, I know the actor Matt Damon does a thing, you know, similar to that for water for developing countries in Africa. Do you guys ever work with the nonprofits?
We don't work directly with nonprofits overseas, although once people become alumni of our programs, we do have an alumni office. It's a separate office in the Bureau of Educational and Cultural Affairs, and they have a small grants program where they do give our alumni overseas grants to do projects for things like that.
Interesting.
The word that most people use about the IVLP when we ask them about it is life-changing. They say it was a life-changing program, and I hear that all the time, and it's really true.
Wow. Let me ask you a political question, and of course you don't have to answer, but you're a career civil service, foreign service officer. So you've worked obviously in multiple political administrations, both parties. Have you found that you're pretty much below the fray? I mean, are you ever, or how, you know, how would you, because to me, it seems like you go 30 years through a career, but you've got people above you with the revolving doors of political appointments. Have you felt like you've been able to do your job all the way through the way you wanted to, or have the political influences trickle down to you where you're at?
It's a hard question to answer. Foreign service officers, when we join, we take an oath to the Constitution. And I feel like I've been able to fulfill that oath and work for the American people in my job. And I think currently I have the best job in the State Department, because not only because I get to meet a lot of visitors coming in, but I get to meet people like Gina and you all across the country. As when I
Right.
was able to travel, I like to visit our communities and talk to the people in person. It's just such a community. We call it a network, but it's also a community of the stakeholders, the people who are involved in IVLP, and it's such gratifying work. It makes me proud.
Well, in reading your bio, obviously you've been stationed in a lot of very unique places, but do you know what like the number is? Like how many countries have you been to? I'd love to know.
Oh, I've never counted. I've lived in, I think it's 6 different countries now, but obviously I traveled when I was posted in countries. Probably the place I've been that fewest people have been is probably like Timor-Leste.
I've never even, now where is that? Is that Africa?
It's-
Where
No, Timor-Leste is
where is
Southeast Asia. It
Southeast
was
Asia, okay.
part of Indonesia until 1990 or 1992, somewhere around there. It gained its independence. So it's one of the newer countries in the world.
But it's very, very sparsely populated.
It's a very, very small country. Yes.
Now, let me ask this question, and this is just kind of in jest a little bit, but I've heard stories about certain Americans, overseas being targets or whatever of terrorism. Do you maintain a low profile when you're traveling, and how do you handle that for safety and security when you're traveling to all these countries?
Well, every U.S. embassy and consulate has what's called a regional security officer,
Mhm,
and they
mhm.
give us advice.
Gotcha.
There are places where we're advised not to travel if the situation is dangerous. But I feel that if you comport yourself as a genuine human being, you get that genuineness back, and I have never felt endangered while traveling. I'll
Wow,
put it that way.
fantastic. Okay. Well, I'll tell you what, you guys, what a great morning. I appreciate everyone coming. I can't believe an hour. Look how fast an hour goes by. Just a great conversation. I want to thank each and every one of you. Director Grimes, thank you for waking up early. I know you wake up early. You said it, but spending an hour with us and really giving us some insight into something the average person in Escambia County may not ever know about. So appreciate that. Gina, thank you for being on the show and for sending so many people to my site. It was fantastic. Chandra Smiley, I know the last 20 minutes or so, you've kind of just been a listener, but thank you for hanging with us. And thank you for working with us to get people tested in our community. We really, really appreciate that. And you just don't know how helpful you've been. And of course, Janice Dealey, you're a trooper. You're here every week. Appreciate it. And everyone, I hope you all have a great rest of the week. Thank you so much for being here.